Well, good morning, good afternoon, and good evening, everyone. Welcome to our webinar today. My name is Kate Darty-Schmeck, and I serve as the Executive Director of Global Arch, which is a global alliance dedicated to improving lifelong outcomes for those who are impacted by childhood onset heart disease. We work directly with patients and families and community leaders to drive change around the world and in local communities. I also serve as the co-chair of the Non-Communicable Disease NCD Working Group for the Global Health Council. The Global Health Council is the leading member organization working to advance global health priorities by bringing together advocates, implementers, policymakers, and stakeholders to drive meaningful action. As part of these efforts, GHC hosts advocacy working groups, such as the NCD Working Group, that provide members with opportunities to connect, collaborate, and to take action on global health challenges. Our NCD working group unites organizations who are focused on improving care for people living with NCDs. That includes groups that focus on community health workers, mental health, clinical and research support, direct care and services, and also patient and family support networks. We bring together a range of NCDs, including cancer, heart disease, oral health diseases, childhood onset NCDs, and more. Our current focus, pardon me, includes educating and raising awareness about NCDs, highlighting the investment case for NCDs, especially emphasizing how prevention, early diagnosis, and timely treatment can save lives and reduce healthcare costs. We align the NCD community to engage effectively for the 2025 United Nations high-level meeting on NCDs, a key part why we're here today. A special thank you to our co-hosts for the webinar today, the Global Health Council, the NCD Alliance, and the Global Mental Health Action Network for making this webinar possible. Today, we'll focus on an overview of the United Nations high-level meeting on NCDs and mental health. We'll talk about the process and key timelines and advocacy opportunities that lead up to the high-level meeting, including resources and strategies to enhance your advocacy efforts, as well as opportunities for collaboration in shaping the global NCD and mental health agenda. Before we begin, we'd like to take a brief moment of reflection in remembrance of those that we've lost to NCDs and to mental illness, including Charity Maturi, who shared her story on our last webinar and her incredible work. We lost Charity a few months ago, and her memory continues to live on. Her dedication and advocacy left a lasting impact, and her memory continues to inspire our collective efforts to drive change. We honor her and all of those that we've lost by continuing to fight for better care and policies and investments in NCDs and mental health. Each life lost and each person impacted drives us forward, and we don't forget them. Before we get started and I turn over to the first speaker, I just want to go over some friendly reminders. First, please submit any questions in the Q&A box located on the bottom of your screen at any time. We'll adjust them throughout the session, and then we'll also have a dedicated Q&A segment at the end of the webinar today. As a note, this webinar is being recorded and it will be shared publicly along with the presentations. We'll also share key resources in the chat throughout the webinar, which will also be shared in the follow-up email and shared publicly. Now, on that note, it's my privilege to introduce Marika Kremen, who's the Policy and Advocacy Manager at the NCD Alliance. She'll provide insights into the high-level meeting and key advocacy opportunities. Marika, over to you.
Thanks so much, Kate, and hello, everyone. It's a pleasure to be here with you today. As Kate mentioned, my name is Marika. I'm the Policy and Advocacy Manager for NCD Alliance. I'm based in New York City, so I'm coordinating our UN advocacy in this exciting year, as well as covering our financing policy portfolio. And before we get into the sort of meaty content of the webinar today, I just wanted to sort of give a little bit of a briefing in terms of the timeline, objectives of the high-level meeting, and opportunities for engagement that will really help us frame and shape the rest of the discussion. So for those of you who are not aware of what a UN high-level meeting is, it is a frequently in-held sort of convening of the UN General Assembly on a special topic. This means that it's taking place in New York and not in Geneva under the WHO, which I know a lot of folks here are more accustomed to engaging with. This means that the meeting is more political versus technical in nature, and there's actually going to be an outcome document, a political declaration that contains commitments for governments, as well as the international system to advance a common understanding and pathway forward for the agenda at hand. So given that this is actually going to be the 4th high-level meeting on NCDs, the first one happening in 2011, we're really looking for this high-level meeting to reprioritize NCDs on the political global agenda and refocus that attention internationally, reiterate commitments that have been made, review the progress or maybe lack thereof, and agree on a common path forward. So what do we already know about this high-level meeting? Well, there is currently a modalities resolution that outlines the process and procedure of the high-level meeting that's set to be adopted next week, actually. So once that is officially in place, the rest of the UN system will be given a green light to move ahead on this. The process is going to be shepherded by 2 co-facilitator countries, St. Vincent and the Grenadines and Luxembourg, and they're the ones facilitating those negotiations across the UN member states. The modalities resolution also has key information like the date of the high-level meeting, which is slated now for the 25th of September, meaning that it's going to be taking place during the UN General Assembly opening high-level week. And as well as giving us a theme for that meeting, which is going to be equity and integration, transforming lives and livelihoods through leadership and action on non-communicable diseases and the promotion of mental health and well-being. So for those of you who have followed the high-level meetings previously, you'll notice that this is actually a little bit of a shift because we're now seeing the high-level meeting title, rather than just explicitly focus on NCDs, broaden its scope to align with SDG 3.4, which is on the reduction of premature mortality of NCDs and the promotion of mental health and well-being. So we're really seeing member states sort of round out that discussion in a way that they began in 2018 with the explicit inclusion of mental health in the NCD agenda, and continuing on that trend as we close out this SDG era, which ends in 2030. So at the high-level meeting, we can expect that governments, of course, will participate, hopefully at the highest level possible, meaning heads of state and government, although it's quite frequent that we also see ministers of health representing their governments at these meetings as well. But there's also an opportunity for multilateral agencies, civil society, relevant private sector, philanthropies, and academia to attend and participate in the meeting as well. But also really important is that member states, especially the co-facilitators this year, have emphasized that they want to create a document, an outcome document that is action-oriented and has measurable targets and mobilizes political will. And I think that for us, that target thing is going to be a really big and key component, because previous political declarations on NCDs have notably been sort of lacking on this front. And you know what the saying is, what gets measured gets managed. So hopefully that will also be a really good tool for us as advocates to utilize in driving things forward. So I am actually gonna just throw a slide up for my visual learners to sort of give you a picture of the timeline of what we're working with. And of course, I'm not finding my view present slide. So we're gonna go with it. And apologies for that. So in terms of the timeline that we have, you can see that we've listed here Geneva opportunities as well as New York City events. This includes everything from the WHO EB through the World Health Assembly. And then on the bottom here, you'll see all of the New York activities. But I want to go ahead and draw your attention to two key parts of this. One is the third symposium on meaningful engagement of people with NCDs, mental health, and neurological conditions. This is going to be a key opportunity for people with lived experience to speak directly to member states about the issues at hand. And the second is a UN multi-stakeholder hearing, which will take place likely towards the end of April, beginning of May. Once we have the modalities resolution adopted, we'll finally, get a date from that. But this is really a key opportunity for us as civil society to input into the process. Member states are very aware that this is happening, and it's something that we've seen in the past several high-level meeting processes. So we can be assured that they're really primed to pay attention to us at this point in time. And it's also coming at a very opportune moment because the political declaration drafting process will begin shortly after we have that modalities resolution, and member states will actually begin negotiating that text probably in June and July. So this is like I said, our time to really come in and have an input and influence on the process. All right. So in terms of, other key milestones and opportunities for engagement, I just want to flag that there are, going to be a couple of things coming down the NCDA pipeline, which I'll talk more about later. But in terms of, these key opportunities, those two meetings in Geneva and New York are the ones that I would really flag as, being important to engage in and show up to if you're able. There's also a ton of opportunity to sort of triangulate messages across New York, Geneva, and Capitol for these political meetings. So we actually have, NCDA has actually produced a pocket guide on sort of how to start thinking about and formulating that for those of you who might be new to working in this sort of like international UN space. And I believe that GHC colleagues are going to pop the link for that into the chat if you want to take a look at that. But that is sort of the quick tour of the HLM process, and I'm going to hand it back over to Kate. Thanks.
You, Marika. I love that term, the tour too of it. We wanted to make sure we provided a very brief overview before we went into more details on what to expect during the high-level meeting. But as you can see and you hear, there's not a single moment in time or a certain location where everything's happening. It's a continuous path that our community is working towards to make change, and a lot of work that goes into it. So thank you to all who are making that happen. On some I also want to mention that it's wonderful to see that the focus is not only just on NCDs, which is wonderful, but also on mental health and the well-being and the overall patient, which is key in moving this forward. And there are many opportunities for all stakeholders to be involved. As some key reminders, this webinar is being recorded and it will be shared in follow-up to today with all the resources and also the presentations that are shared. And we also will be GHC will be hosting a calendar with different side events that are happening during the World Health Assembly or the high-level meeting on their website that we can share the link as well. But when we talk about the high-level meeting, let's also talk about what are we actually working towards. There's a lot of organizations who are working on different advocacy efforts, but we also have a lot of collective advocacy. So on that note, I'm going to turn to my fellow NCD Working Group co-chair, Makiba Charles Ayinde, who's the Director of Science Policy for the International Association for Dental, Oral, and Craniofacial Research. Makiba will highlight the collective calls for action for NCDs and mental health advocacy. Makiba, the floor is yours.
Thank you so much, Kate. Give me 1 second to just share my screen. Hopefully you all are able to see that now. So as Kate mentioned, my name is Makiba Charles Ayinde, and I am the Director of Science Policy with the International Association for Dental, Oral, and Craniofacial Research.
Makiba, is there any way to put it in presentation mode?
Oh, is it in presentation now?
No, it's not.
Oh,
Sorry.
it says it is.
Now
Let's
it is.
try.
It's good.
Okay,
Thank
so
you.
there's a little bit of a delay. So I'll share it again and then just give it a few seconds and it should switch over to the full screen. Okay, so and as Kate mentioned, I am the other half of the chair of the GHC NCD working group. So as we continue to move quickly towards the UN HLM on NCDs, advocacy becomes an essential tool that we can use to urge all governments and all stakeholders to fulfill their commitments to address the burden of NCDs and mental health. So we know, as Marika just said, most of the work is being done now prior to the meeting in September. So we wanted to do a quick overview of some calls to action, collective messages from groups such as the Global Health Council, the NCD Alliance, as well as the United for Global Mental Health Group. Hopefully you guys can see my slides. If not, I'll proceed and it will be shared following the meeting. So the collective messages have been aligned over 7 themes. We'll start with governance and community engagement. We encourage you to include in your advocacy messages the need to strengthen inclusive health governance by institutionalizing mechanisms for meaningful engagement of people living with NCDs and mental health conditions. Also prioritize social participation in policymaking, in advocacy, and in research to ensure equitable and people-centered responses. Also include support for civil society, communities, and individuals affected by NCDs in advocacy and in your decision-making processes, as well as addressing stigma and discrimination to improve access to care and social inclusion. Another collective theme is sustainable and equitable financing. And we all know financing is huge. So please consider including ensuring adequate, predictable, and sustainable financing for NCD prevention and care, investment in evidence-based policies and financing mechanisms such as WHO Best Buys, WHO action plans, and the WHO Mental Health Action Plan 2013 to 2030, as well as establish integrated funding streams that link NCDs with maternal and child health, mental health, and primary health care. A third theme is along the line of strengthening health systems and universal health coverage. Please consider including the integration of NCD prevention, treatment, and mental health services into UHC benefits packages. The need to strengthen primary health care and invest in health system reform, as well as establish a continuum of care from prenatal through postpartum to ensure screening and early intervention. The fourth theme is in investing in healthcare workforce. We want to pay healthcare workers fairly, including community health workers. We want to improve training and task sharing to alleviate workforce burdens and enhance capacity. And we also want to prioritize self-care, well-being, and mental health support for healthcare workers. The fifth theme is all around data, digital health, and accountability. We want to strengthen data collection and surveillance systems so that we can track progress, understand risk factors, and use targeted interventions effectively. Research, 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 key for this. We want to invest in digital health tools to address inequities and expand healthcare access, as well as ensure robust accountability mechanisms so that we can measure progress and fulfill commitments to NCD prevention and care. The sixth theme is along addressing social and commercial determinants of health. So tackling social and commercial determinants of NCDs that include harmful industry practices and environmental health risks. And we want to link NCD policy efforts with climate action to promote health-enabling environments. And then the seventh and final theme is to accelerate implementation and break down silos. We want to fast-track national implementation of evidence-based NCD policies, prioritizing marginalized populations, and we want to center NCDs within global health and development agendas to foster cross-sectoral collaboration. So we will be sure to circulate these collective, cohesive messages following the webinar to ensure that we speak with a strong, collective, and united voice as we march onwards in the next few months. So Kate, over to you.
Thank you, Makiba. That was wonderful. And it's not a Zoom webinar without some type of hiccup, right? But thank you and giving us a little challenge. So thank you though, Makiba. I very much appreciate that. It's all clear we're working towards a common goal in preparation for the high-level meeting. And these call to actions are highlighted in all of our partners' work, where we will review in a few moments. Before we dive into that, as a reminder, please put your questions in the Q&A. Our speakers will answer them in the chat or also in follow-up to this segment of the webinar. So this section now will focus on some of our partners and their work that they're doing in preparation for the high-level meeting. You'll hear a lot of the key themes that Makiba just reviewed in the collective call to actions, but they'll do a very quick overview of their plans and how you can get involved. All of these materials will be sent in follow-up to this webinar today and will be shared on the Global Health Council website so that if you miss anything in the chat, you'll be able to access it after. Our leaders will also be sharing other key events where you can learn even in more details on what all the different advocacy that's happening for the meeting. So I'll first turn to back to Marika, to highlight some of the work that the NCD Alliance is doing in preparation for the high-level meeting. Marika?
Thanks so much, Kate. And I'm kind of keeping an eye on the chat, and it's really great to see so many NCDA Alliance members and friends of the network popping in. So special hello to those folks. So this is probably going to be a bit of a repetition for them. But in terms of NCDA's plans for engagement and upcoming work, as I mentioned, the multi-stakeholder hearing is a really big opportunity for us. We're planning on bringing about 30 of our advocates to New York. So these are folks that are participants in our Views, Our Voices diary series, which chronicles the lived experience of people living with NCDs across the world, as well as members of our national alliances. We have another programmatic element that helps nascent national and regional alliances really get on their feet and provide information and support to build those strong national voices to take these international conversations down to the national level. So we're really excited to have a lot of those folks hopefully joining us in New York. Visas, of course, pending. We are also going to be hosting a series of general open informational webinars as the sort of process evolves. There's not a ton to talk about right now, just with the modalities resolution still being under negotiation. But you can look forward to that. And that's a sort of unique opportunity for us, as we're a member-based organization. A lot of our activities are usually targeted for members, but of course, with the high-level meeting happening this year, it's a big special year, and we want to make sure that all of this information is open and available to folks. And then I also want to highlight two of our sort of big campaigns that I would really encourage everyone to get involved in if they're able. The first is the Call to Lead. This is an open letter to governments and was crafted with an advisory group across our membership. And it focuses on three of the priorities that we've outlined. So delivering accountability, mobilizing sustainable investment, and accelerating implementation. We really felt like those were sort of the big three things that we wanted governments to hear in terms of what really needed to move forward for this political declaration. And so this letter is open for everyone to sign on to as individuals or as organizations. So I think a link will be coming to you into the chat for that. If not, I'll post it in there after I'm done speaking. But this is a sort of a really good key opportunity to sort of contribute to this sort of mass statement on NCDs. And this also kind of includes the Kigali Youth Declaration. NCDA held a forum just 2 weeks ago in Kigali, and our youth delegates drafted a youth declaration in terms of what is really important to them for the high-level meeting. So if you're youth, I will leave it up to you to decide if you still count as youth. That's also available to sign on to. And then the second is our Global Week for Action campaign. The website for that is actonncds.org. That has a ton of resources and information in terms of events happening all over the world. You can submit your own, but we're also throwing up resources for folks for supporting their own advocacy work, whether it's in Capital, in Geneva, or New York, to really facilitate the participation, lower that barrier of entry for everyone. So you can still, contribute to the discussion without having to make it your whole personality, I guess. So, those are really sort of big key opportunities in addition to the events that we're planning at the multi-stakeholder hearing at WHA and at UNGA itself. And I will park it there. Thanks, Kate.
Thank you, Marika. That's absolutely wonderful. As Marika mentioned, there's a lot of opportunities both in person in Geneva or New York to participate with the NCD Alliance on all of their advocacy efforts. And I love the fact of how much you involved individuals with lived experience, because that is key in moving this forward. So thank you for all of that. Again, all of our partners that will present today are very much updating their websites in real time as new updates come out and as new resources are available. So please continuously check those resources. But on that note, I'll turn to Antonis Casualas, who is the Director of Partnerships and Secretariat Lead for the Global Mental Health Action Network. And Antonis, I'll turn to you.
Thank you, Kate. I'll do a brief overview as well of our work. For those of you that don't know, the Global Mental Health Action Network is the world's leading network on mental health advocacy. We have almost 6,000 members from 170 different countries and territories, and we're hosted by United for Global Mental Health. We're doing a lot of things in the lead up to the high-level meeting. We are convening a task force of international organizations that are working on mental health. We are convening a short-term action group of advocates, people with lived experience, people leading local and national work in their countries and civil society. Many of them are here, so it's great to see lots of familiar names in the audience. We will be taking a lot of our advocates with us to meetings in New York and in Geneva in May. We'll be supporting people to participate online as well. We will also be, we'll also look to do a lot of soft influencing. So beyond the formal meetings, we'll want to visit negotiators, missions, countries, governments, and other people that hold influence alongside our advocates to raise the profile of mental health in the high-level meeting. As Marika said, it's a little bit of a new thing for this high-level meeting to have mental health at the core. It's a unique historic opportunity for mental health to be part of that conversation at this level, and we want to maximize that opportunity. Of course, many of the areas are shared with NCDs, but there are also some unique areas for mental health, including suicide prevention, youth mental health, and the deinstitutionalization and moving towards community care in mental health. So we will also be holding side events at the World Health Assembly on these topics alongside a number of partners. And expect a number of reports on these topics in the coming few months. You can go on our website and it's right there on our main page. You can find the links to the work we're doing at the high-level meeting, and we have a very regularly updated roadmap with all the key dates and the kind of milestones for influencing for the high-level meeting there as well. So yeah, we'd be delighted to work with the global community of people interested in mental health. We'll be launching a communications campaign in the next few weeks as well, and you'll be able to amplify that messaging and kind of use that also in your work. If you join the network, if you're not a member already, we also have knowledge exchange sessions and webinars, and some of them will be directly related to the high-level meeting. So lots to engage with and to do, and yeah, please do join us.
Thank you, Antonis. I myself am a member of the network, and it's amazing and very much appreciate all the work that you're doing. Thank you. Again, it's so wonderful to hear how all these groups are really including patients and their families and those with lived experience in all of their work and their advocacy efforts. Thank you. It's not just one moment in time, but so many different opportunities to be involved, and very much appreciate all of that. I also love that you highlighted there's a new opportunity for mental health to be included, a key part of what to move forward this NCD work, not only for those who are living with heart disease or diabetes or cancer or other NCDs, but also mental health in general to really help to address that. So thank you, Antonis. So My organization, Global Arch, works with individuals who are patients and families, those with lived experience, and we have the true honor to collaborate with Children's HeartLink on a lot of these advocacy efforts. So on this note, I'm going to turn to Bisha Javela, who's the Vice President of Global Strategy and Advocacy at Children's HeartLink, to discuss some of our advocacy efforts.
Thank you, Kate, and thank you to the Global Health Council for putting this webinar together. Let me see if this would work. Can you see it in a presentation mode?
Yes.
So I will be quick. Our campaign is not as broad as some of the others that we've heard about, but we represent, as Kate said, Children's HeartLink, which is the organization I work for. It's an NGO that's focused on advocating and building capacity for pediatric cardiac care, and Global Arch, which is an alliance of patient and family advocates globally. And we actually co-chair together the Global Coalition for Pediatric and Congenital Hearts, which is an advocacy coalition that has broader advocacy goals. But we've seen this high-level meeting as an opportunity to actually advocate for childhood onset non-communicable diseases. And why are we doing that? They're actually widely excluded from any of the goals. So people with type 1 diabetes, people with congenital anomalies or congenital conditions that like the ones that we are working on, people with potentially rheumatic heart disease, people with sickle cell disease, those are often, if they're under 30, they are excluded from the global goals, from the Sustainable Development Goals. So we are hoping that we can add some traction by reaching out, actually more targeted outreach to several governments where we presented this. But as in terms of some of the evidence that we see, we actually have evidence published that there is a significant burden, and that's been ignored. As you can see here on my slide, birth defects, especially, those are excluded from any of the targets as well. And congenital heart disease, which is the one condition that we really work with this population, is the most common birth defect. 1 in 100 children is born with a birth defect. And I think the challenge here happens is because most of these either mortality or morbidity happens in early age, and they're just not recorded. And no one really knows what happens to them. So some of the asks that we have is really, they're very basic, and we support everything that as a member of NCD Alliance, we support everything that the NCD Alliance has in its advocacy asks. And I, again, would encourage everyone to continue to follow their wonderful work. But we hope that this political declaration will actually have included something about a childhood onset non-communicable diseases. There are other organizations that are planning events. We still don't have a full-fledged campaign, but as I said, we have some targeted asks that we've reached out to different governments and missions in New York to talk to them about. So far, we've seen a good response, and we're kind of waiting to see where the negotiations will take once they start really accept the modalities and everything. So, but in terms of the asks, quickly, integrated approach, like we're all talking about screening, diagnosing, referral, and treatment, as well as lifelong care follow-up. Treatment to be included in universal health coverage plans, which I know we're all asking for, but it is something that we should continue asking until it happens. Strengthening data collection. Again, as I said, these are morbidity, mortality that is not counted in many different ways. And that's why they've been largely excluded. In investing in a specialized healthcare workforce, we do believe primary care is the weaker link, and that's important to have a good connection. However, most of these conditions still need specialists to have appropriate treatment. And of course, engaging civil society and patient community, specifically patient and family advocates in this process. So that's it for me. Again, we have reached out to several countries. If you have thoughts on this, please reach out, and I'll put in the chat box one resource that we've put together, and we'll be putting more things in place. Thank you.
Thank you, Bisha. That was wonderful. As Bushra mentioned, there's a significant global burden for this patient population, and one of the most vulnerable patient populations out there too, are our babies and our children who are growing up to be adults to give back, and we need to make sure that we're addressing this as well. So as we talk about, the broader NCD landscape as well as more targeted approaches, I want to make sure that we have set time also for our team member from Sightsaver, Sarah Collinson, who's going to share more about their work and their advocacy efforts at Sightsavers. Sarah is the senior policy advisor for their team, and I'm going to turn to her to do a brief overview. Please, Sarah.
Thank you very much, Kate, and hello to everyone on the call. So I'm representing Sightsavers today, and we work in over 30 countries in Africa and South Asia. As the name suggests, we work to prevent blindness, which is a key part of our engagement on NCDs at all levels, but also a lot of our work is devoted to promoting the inclusion and rights of persons with disabilities across the board and in all areas of health, as well as other areas of health and disability inclusion and rights. And in that respect, we work very closely with a consortium of organizations called the International Disability and Development Consortium, IDDC. And in a moment, I can put a link to the chat for anyone who's interested in getting involved in the work of IDDC that we at Sightsavers do jointly with them around health and disability inclusion. So some of my remarks today are relating to that joint work, which, and as I said, in our work in the health sector, we're very open to collaborating, and very much as Antonis was explaining in the mental health space, we'll be using every opportunity that we can this year to work with Global Health Council, with NCD Alliance. We also like to, that we collaborate with NCD Alliance and IDDC to try to get across some of our key messages, which we feel are very important in the intersection of NCDs and disability. I think it's probably well recognized that I think already a key metric in the NCD policy world is disability adjusted life years, or dailies. So it's a key metric that's already used to measure the overall burden of disease from NCDs at the kind of population level. And we know that NCDs account for 81% of years lived with a disability globally. So there's obviously a really close relationship between disability and NCDs. But a lot less recognition has been given, we think, to how health inequities associated with disabilities play a part in the health outcomes associated with NCDs. And without that recognition, there isn't enough action in that space. So we know that persons with disabilities experience higher rates of NCDs, they experience worse health outcomes compared with the general population. And a lot of these inequities result from unfair conditions such as discrimination, health system barriers, social determinants of health, and a greater exposure to health-related risk factors. So just for some examples, persons with disabilities, including those who have disabilities from NCDs, are 3 times more likely to be denied healthcare, 4 times more likely to be treated badly in healthcare facilities. Health prevention and promotion campaigns often don't reach persons with disabilities because the information isn't accessible to them. And then, and particularly in relation to the high-level meeting this year, it's important to note that persons with psychosocial or intellectual disabilities, people with mental health conditions, are often the most left behind, often with very limited choices of rights-based support in the community, for example, and even maybe exposed to human rights abuses in residential facilities. So these are some of the areas that we really want to shine a light on in all of our engagement in and around the high-level meeting this year. And we'll be sharing some of our key messages, and our calls for action are about getting better recognition of persons with disabilities as being disproportionately affected by NCDs, and the opportunity to take more action and to invest in disability inclusive health systems, to which actually will improve health outcomes for all and contribute, quite substantially to improving key health indicators associated with NCDs. So our calls to action focus very much around political leadership to integrate and mainstream disability inclusion in NCD care and services, to ensure meaningful participation of persons with disabilities in policy and service development, to improve disaggregated data and introduce disability-specific indicators for NCDs, increase investments in inclusive services and also in rights-based care and support for persons with psychosocial disabilities and mental health conditions, and to ensure that all of these aspects are given proper attention in emergency response planning, where there might be lack of access to continuing services for NCDs as well as other aspects of health. So that in a nutshell is the kind of area that we'll be focusing our key messages. I will put the link to the IDDC consortium for those of you who have a specific interest in disability would like to collaborate with us in our engagement around the high-level meeting. Thank you.
Thank you so much, Sarah. I think, from hearing from all these different speakers and what Sarah just talked about is there's so much overlap in what all of our populations are facing and how, especially when it comes to disability. So it's so wonderful to hear all the different work that's being done across the field. So we are now going to turn to a live Q&A. I'm going to ask all of the speakers who just presented to turn on their videos for this. And all of our speakers are also answering the questions in the chat as well, but we'll highlight some of the key questions that came up. As our speakers are turning on their videos, I just want to quickly highlight to please add any Q&A, any questions in the Q&A box at the bottom of your screen. It's a little question mark and it says Q&A right underneath. I know sometimes it's Zoom and all the different platforms, it's where is it a question that comes along. So that's where it is. You can add your question in there. And if we don't have time to answer it today, we'll make sure that we follow up with you. I saw a lot of the questions that have been coming through. One of them was about the multi-stakeholder meeting that Marika mentioned. I just want to quickly say that meeting has not yet been confirmed the date, that they're still in their silence period, so that has not been confirmed. Marika, I don't know if you want to add anything about that, but I know that's a common question that we're seeing coming through.
Yeah, no, Kate, you got the basics of it all down. If folks want a more technical answer, the answer is that the modalities resolution, which is under silence, is what gives the office of the president of the General Assembly the mandate to host this meeting. So they can't technically announce the date for the meeting that they don't have the authority to hold until that resolution is adopted. So that resolution is on the agenda for next week. Shortly after it's adopted, we'll hope to get official confirmation of that date. But like we've been saying, we're expecting it to be late April, early May. So it will be before WHA.
Thanks, Marika. That's great. And I know we asked all of our speakers to very quickly talk about all of the work that they're doing. It was very quick, but we do have many resources that we mentioned that were shared in the chat, and they'll be sent in follow-up to today. So if you missed anything, don't worry, you will receive it. And all of those websites are being updated with the key dates, as Marika mentioned, for when more details are confirmed. One of the questions that came through, and I think, a key part of what we wanted to do today was there's all this different work that's being done across advocating for NCDs and mental health and well-being. And, there's a lot of, NCD Alliance in particular is doing a lot of broader work around advocating. And then there's individual organizations who are doing more targeted NCD or mental health advocacy. I was hoping that maybe, Marika or any of the speakers could talk a little bit more about how is this, while there's a lot of advocacy going on, how are we avoiding fragmentation of the messages and making sure that policymakers are really engaged in this work?
Yeah, that's a great question. And It's something that actually came up a lot during our forum the other week because, you know, NCDA, like the Global Action Network for Mental Health, is, you know, very broad encompassing. We have over 400 members, including 70 national alliances. So we see a lot of expertise coming from these organizations on specific diseases, risk factors, populations, national perspectives. And I think the analogy that we gave is like we're playing a piece of jazz music, right? Like there are so many things that we have in common in terms of our key asks, which is what, you know, NCD Alliance really did try and focus on in its policy brief, are these uniting factors that apply to everyone. And using those asks as sort of the basis to add your own context and color and examples. So, you know, it's very easy to say like, you know, UHC, well, what does integrating NCDs into UHC mean for you? And really focusing on that integration piece as the sort of key ask, and then highlighting it with those examples. I would, you know, invite everyone also to, you know, refer back to that call to lead as a really good example of how we're looking to unify all of these different stakeholders under these key themes. But of course, you know, this challenge is not one for NCDs alone, because we do focus on that broader NCD agenda. So I want to give space to everyone else to chime in.
Bisha, do you want to add it? It looks.
Yeah, I would agree with Marika. I think that I mean, NCD as a term is so broad that partially that's been the challenge of you know, why it's challenging to advocate for NCDs. But looking at these broader health systems asks that the NCD Alliance has is very important. And so we are very much in support of that. For example, I mean, I talked about a specific issue, and more the issue is think about this population as well. But within, again, those asks about the financing, about integration. And so I think that that's what's important to this is an opportunity to raise awareness. And it's an opportunity to educate policymakers. It's an opportunity to educate actually politicians more so than policymakers. And so that's why we should be talking to people, and we should be saying the things that are important to us. Otherwise, I don't think anyone is under the illusion that this is easy. It's not easy at all. NCD Alliance, you know, has been in place for such a long time, and you know, we've been advocating, all of us, a big community for non-communicable diseases for now so many years. And it's going to be complex. I mean, I don't think that's people have illusions that it's easy. So that's my comment.
Thanks, Bisha. That's a great point. Sarah, I'll turn to you, please.
Yeah, thank you. I just wanted to echo the importance of aligning, and for us it's really important to align with those higher level messages. And when we are speaking specifically, for example, about persons with disabilities, what I probably didn't have time to kind of communicate is how important it is, and how we emphasize not only is that a kind of cross-cutting challenge when it comes to sort of broader health equity and inclusion action, but the intersection of disability with lots of other vulnerabilities, and just how important it is to recognize that action, whether it's for persons with disabilities, is going to be benefiting the whole system, strengthening the whole system, and is part of that broader health system strengthening approach to NCDs and to reaching all those populations. And whether that is the, you know, linking disability and aging and what that means for improving NCD services, etc. So yeah, that linkage and linking under those key messages is really important.
Sarah, that's so well said. Thank you for that. And I think that really does tie it all together so well. We are coming to the close of the webinar today, but before we do that, and before I close the webinar, I have a question that kind of brings together a lot of the questions that we've received in the Q&A box. And each speaker spoke about it in some capacity, but if you could each speaker quickly mention 1 to 2 ways that all of our community who's here today or others can be involved, whether it's from events or supporting your advocacy efforts. Is there an elevator pitch that they can use or type of information? But is there 1 to 2 ways that our community here can be involved, whether it's for their specific disease or overall advocacy? Antonis, I'm going to start with you, if that's okay.
Thank you. Yeah, I guess my elevator pitch is to educate yourselves on the links between mental health and NCDs. There are so many areas of overlap and so many important issues that need to be addressed to improve prevention and care across multiple conditions and on both kind of broad areas. We do have a brief that outlines the key position statements for mental health. It's been shared in the chat already, so you can use that to drive awareness and influence in your communities and with the people you work with.
That's fantastic. Thank you. I'll turn to Sarah.
Thanks. I think it links really well with what Antonis has just said, because we obviously have a particular interest in mental health as well. But I would add to that to really pay attention to the health equity aspects of the NCD agenda and ensuring that health equity and action to ensure inclusion and accessibility for all population groups. Even those who you would think are being reached automatically, such as those with disabilities from NCDs, to make sure that those barriers and those inequities are being addressed and are at the center of the agenda. Thank you.
Thank you, Sarah. And then I'll turn to Bisha and then Marika, please.
Yeah, I would say find out who leads the mission of the country that you come from and your organization comes from, and reach out to them. In the mission, I mean the representative of your country at the United Nations, and reach out to him. Find out the person at the Ministry of Health who leads multilateral engagement and negotiations, and reach out to them and say, I represent this community. This is what I think is important. Please talk about this in your negotiations, and please consider it in your negotiations. I think it's easier than we think. And also you should think about these people work for you. If you come from any country, you have representation there. These people work for you. And so it's easier than probably you think. And if you need partnership, you see there's so many organizations here represented. If you care about a specific issue, reach out to one of those organizations to support you.
Great point. So many organizations out there to support all this work and to come together. Marika, I'll turn to you before I close out today.
Sure, thank you. So in terms of keeping up to date with the most current information, I would really encourage folks to sign up for the NCDA newsletter. This is going to be sort of a key way to receive information in addition to social media. But if you're like me, you're trying to not do that at the moment. So I would really recommend that. That will also include ways to get involved. And then I think we also shared a pocket guide on opportunities for civil society advocacy. So I would invite everyone to just take a peek at that and see what kind of works and drives with what your plans are existing for the year already. And then the sort of final thing that I would say is, not to sound like a broken record, but that call to lead is, really a big public campaign. And, we have seen strength in numbers. And I think that the unification around a central message has been a key lesson learned from the past high-level meetings on health. We've seen different groups handle it in different ways, and the ones that have ultimately been the most impactful and the ones that have really seen most of their advocacy priorities reflected in those final documents have really rallied around a central message. So trying to bring everyone on board to as we've talked about today, highlight these common themes to push forward at the meeting.
Thank you, Marika. That's excellent. And I think that's a great point. For those who maybe are off social media at the current time, please, there's all of these organizations have great newsletters to connect with and to sign up for to learn more that go into details. So I want to take this moment to thank all of our speakers, the hosts of the webinar today, and of course, all of you for joining and being part of this movement. We'll follow up with the tools and resources on how to strengthen your local and your global advocacy efforts in preparation for the high-level meeting. There's many key resources and links that have been shared in the chat, as we mentioned, and if you've seen, and they'll also be included in a follow-up email. How to actually stay engaged. As one of all of our speakers very perfectly put it, thank you for each of you, but participate in the upcoming multi-stakeholder hearing when more information is announced. You can join open member state listening sessions that are currently happening now and over the next few months. Also follow the Global Health Council, the NCD Alliance, or the GHMAN. I think I got that right. For ongoing opportunities, whether through social media or through newsletters or other their website. And thank you. And together we can really drive for change that is needed for stronger NCD and mental health policies worldwide. I want to thank you all for joining today, and let's keep up the momentum and create real change. Thank you.